But this is the way this dental disease impacts our society. National figures show that 3.1 days of school per 100 students are missed because of dental disease. And so this problem then has a burden on our government-sponsored programs such as the Medicaid or Denti-Cal, it's called in California, our Healthy Families program, and other programs which are you and I as taxpayers support. It also has a significant negative impact on our district's ADA, our average daily attendance. And we projected it to be about $79,000 per year that we're losing because children are missing school. And I don't mean missing school from going to the dentist and having the treatment done. I'm talking about children who just won't go to school because they're in pain. There's a difference. It also has a very negative impact on our families, especially for the low-income families. When they do have to access dental care, which then becomes very expensive, it really negatively impacts the whole family. And of course, we talked about the hospital admission if the infection goes into a cellulitis. And at our hospital, the cost of that 3-day stay may approximate $20,000. And I can tell you that being in practice for 28 years, there's a lot of dental treatment, a lot of dental services that can be provided for $20,000. And so our mission is got to be to prevent those entities, those things that start out as a single cavity to progress so much that the child has to be admitted to the hospital to be treated. The impact to the child, of course, is you've got a lot of pain, causes lethargy. Kids will be inattentive in school. Sometimes we don't know why, but that can be a cause. They're just very antsy. It's difficult for them to learn when they're in pain. And of course, they lose the ability to chew, so they go for refined foods, very soft foods, and many of them go to sugary foods. Of course, we know that even at a very young early age, even at 3 years of age, there's something called self-esteem. And though most adults think, well, he's only a 3-year-old, 4-year-old, even a 5-year-old, missing a tooth or having a bad tooth in the front of the mouth is not a big deal. But I can tell you that it is. And many of these children will not smile. They'll speak with their hands over their mouth because they are embarrassed. They're embarrassed to show their dentition. And of course, if the child goes to the dentist many, many times, it's not always the most pleasant experience. We try as best as possible to make the child comfortable, to make the families comfortable. But if they have to have multiple injections, multiple extractions of teeth or restorations, after 3 or 4 appointments, the child is not going to be a good patient. I also want to talk to you a little bit about AB 1433, which is the oral health assessment for school children, which will impact our school district. This was a bill that was signed by the governor September of this year, and it becomes effective in January of 2007. What this bill will require is for parents to provide a certification to the public school that their child attends, a certification that they have received an oral health assessment. Not necessarily a dental patient as you and I may know it with dental x-rays, et cetera, but at least an assessment. Somebody has looked into the mouth and said, there is a problem here.
Where do they get that?
The examination itself or the screening?
Where would they go?
We are presently, and I'll at one of my last slides will show our resources in Long Beach and what we're planning to do, Mr. Meyer.
Thank you.
And so parents will have until May of the following year to comply with this new law. They also will have an out if for religious reasons or if they have no access to care or access to have the oral assessment. then they can provide such notice to the school saying, I could not have my child screened, and so they will be opted out. And what this will do is it'll identify, at least at our 5 and 6-year-old age group, those children who need immediate treatment. And that's where we're going to start, the children who need immediate treatment. And to make the proper referral so that they can receive the treatment that they should have. It'll also provide necessary data through the Office of Education so that studies can be done and perhaps grants can be written to support the ongoing education, assessment, and treatment for our children. These are the resources that we presently have. It's not all bad news. We have a wonderful clinic called the Children's Dental Health Clinic, which has been in Long Beach since 1932. It is presently housed at the Miller Children's Hospital, and with the full support of our hospital. We also have the Smile Bright program, which is a school-based education or health education and sealant program. And this program has been shown to be very, very effective excuse me, in reducing the amount of incidence of decay on the permanent molars of children. So usually by 6 or by 12 years of age, we like to seal the first or second molars. And so this program has been very, very effective, and I think that it's something that we need to enhance. We are very lucky in Long Beach to have a residency program in pediatric dentistry affiliated with the USC School of Dentistry and also Miller Children's Hospital. And we've been there now 17 years. We graduate a resident, 2 residents per year, every single year. And these doctors who are in training for pediatric dentistry provide the services for special needs patients, for kids that have to be sedated or admitted to the hospital to provide the dental treatment. The Long Beach Department of Health and Human Services has been great to work with. They're on board, and this will be a good collaboration, as is the Harbor Dental Society, who is 100% behind this initiative. Of course, we have several pediatric dental offices in Long Beach that have been providing dental treatment for kids for a very, very long time. And so now we have something called the Long Beach Children's Oral Health Task Force, and I'm humble and honored to serve as inaugural chairperson, and we're going to do some good work for our children here in Long Beach. The task force is formed by several stakeholders, including our school district representative, and Mr. Bob Williams and Chris Einhauser have been very, very supportive. They attend our meetings. And we have also the Children's Hospital, the Dental Society, a lot of volunteer dentists who are geared to provide services for the kids that need it most. We have set our strategic plan, which has 4 goals, including oral health education, advocacy, oral health services. That means direct treatment for our children. And also, as a long-term goal, the Long Beach Health Department hopefully will have a position called Oral Health Director, which will provide the guidance for oral health services in our city. And the focus of our funding is going to be grant writing and donations. I come before you to provide you information about what we're doing and to hopefully gain your support for this great initiative. So what do we want to do? What we want to do is to expand or enhance the capacity of the Children's Dental Health Clinic in Long Beach. And we're now going to have 15 dental chairs that will be able to provide additional treatment to the already 29,000 dental visits that the Children's Dental Clinic has per year.